Try shocking once a day. 3.
Yeah, well, hey guys, how are you doing? It's good to see you guys here tonight, and it's my desire that we'll be able to get through everything that we have to get through tonight in good time, and that you will enjoy yourselves and you will learn a thing or two. It is always a pleasure being able to share this kind of information with you, and there are a few people who are just a couple of persons have joined in, and people are cutting in and out. Probably these persons are just people who happen to stumble across this video. Um, but we will begin here in a very short while. We'll be talking about the 7 keys to getting and staying well. And so I hope that as we go into it, that whoever joins in, even if they're not current members of our team or invited by a member, that they'll be interested enough to hang around for a little while. But as I'm going through, I'm going to ask that you please indicate your name by just putting it in the chat section. This will allow us to be able to know who is who and that you are listening and that you've tuned in, because at the end, we have a very special offer and we want to be able to know who will be the likely recipients of this offer. So right now it's 20 after 6. I think it's a good time to get started. And so without further ado, let us get right into it. So as we're going through, we're going to be looking at the 7 keys to getting and staying well. The 7 keys to getting and staying well. So as we look through it, let's get right into it, shall we? When it comes to healthcare and understanding how to make decisions for ourselves and for our families that will ensure that we get the most out of healthcare, I've come to realize that if you don't know enough, if you don't understand enough, you make bad choices. So, what I've put together are a few slides that will help us to coordinate our thoughts, to solidify our um, mental faculties or approach, so that when we pursue understanding of this topic, it's something that makes sense to us. And so I hope that this is what you too will find for yourselves as you tune in. So let's begin. The topic being the 7 keys to getting and staying well. Key number 1 is sick care reactive or proactive? When we talk about sick care, we're talking about an approach to health and wellness that is based on a model that waits until something has gone wrong first, and then we intervene to try to remedy that which has gone wrong. This is how the main model has been established. And please don't get me wrong, this is a very important quality about the model, but it's a limitation nonetheless. In fact, when you think about healthcare and health and wellness, it is not a one dimension or monodimensional thing or unidimensional thing. It is multidimensional. And so there is merit to having an approach that says when something has gone wrong, we need to be able to fix it. But that can't be the totality of it. We also have to have a mindset that says, what can we do to prevent things from going wrong in the first place? So we've heard person talk about, especially in our Jamaican context, that an ounce of prevention is better than a pound of cure. And we have this saying that we've been using for a long time. Maybe it's not unique to Jamaica, but it's something that we certainly are familiar with. Well, the reality is, if something has gone wrong, if this is our goal to wait until something has gone wrong first, then we may end up in a situation where the thing that has gone wrong is something that we cannot fix, or something that may claim our lives. And if that is the situation, if this is the reality, then we might be in for trouble. And so we have to have a slightly different approach when it comes to this kind of a mindset. We have to have a slightly different approach. And so what I'm suggesting is that approach. So what am I suggesting? Well, the current model, which basically works on who is sick, waiting until somebody has gotten sick first, we call it a sick care model, is reactive. But if you want to have a chance of achieving true healthcare, then true healthcare is proactive. True healthcare is proactive. And by proactive, we mean if we want to be healthy, we have to try to prevent ourselves from getting sick in the first place. That is it. It's very simple. It's not rocket surgery. But that's it in a nutshell, right? Because if we wait for something to go wrong first, we might be in trouble. So we want to try to prevent things from going wrong in the first place. Because what we find is, based on the current model as it exists, persons are breaking down, persons are getting sick, persons are getting into a diseased state and are not getting out of these states. So that can't be a solution. Managing illness cannot be a solution. Waiting until something has gone wrong and then trying to maintain the person in a state of ill health cannot be the primary objective. But yet still, in the current health model, it is. But the downside to that approach is that if we wait until something has gone wrong, sometimes we can't fix it, the thing that has gone wrong. And so we can be in trouble. Do you know that the number one reason for persons to lose financial stability or their financial gains or to go bankrupt personally, the number one reason is healthcare costs? Somebody, either in their families or they themselves, get diagnosed with a terminal illness or a life-threatening illness, for example, cancer, and the treatment for it or the treatments are so expensive that once you start to embark down that path, you will oftentimes end up in financial trouble. We can't simply wait until these things happen because most of us can't afford to fix it. Most of us can't afford to treat them. So we best understand that if it means spending a little bit more money to buy purified water, to buy fresh produce, fruits, vegetables, especially organic products, that we will end up saving a lot more money in the end. It's just a matter of shuffling our priorities. So more drugs and surgeries cannot be the solution of a lifestyle problem. We have to move beyond that. So that's that, right? Now, if we want to have a chance of being healthy, we have to adjust our thinking. We have to change our mindset. Because being healthy means doing the right things over and over again in order to maintain good health. So let us continue, right? Because we have two models that are contrasting. We have an illness model and we have a wellness model. The illness model is based on the sick care concept, which is reactive. Wait until something has gone wrong first and then we try to fix it. Well, that model is as we've pointed out, is limited. Now watch carefully. there are a few questions that, if you're living in accordance to this model, you will find yourselves asking. So if you ask any of these questions that I'm about to outline with you under the illness care model, then you are thinking in the illness care paradigm and are susceptible to making poor choices, or more susceptible to making poor choices that will affect you in the long run. First question. Let's say you have a headache. Do you simply ask, what can I take to feel better? Do you ask that question? Or, I wonder what is there that can make me feel a little better? Or if you're having pain somewhere, or you're having diarrhea, or you're having heartburn, what can I do or take to feel better? Is that your question? Because if it is, that question is limited. And not only is it limited, but it also sets you up for failure. Because there are many things that persons can do. And in the current model, the pharmaceutical industry, there are so many drugs out there that have the ability to change the way that our body responds to pain or responds to negative stimuli, that doesn't fix the problem but can make us feel a little better. And if your goal is to feel better, then you'll be satisfied with this, and then you'll end up in a case where you are not doing the necessary things to resolve your situation. And so that's a limit. So if feeling better is your goal, you're limited. It is far better to ask a different question. Now, according to the wellness model, the question that one could consider asking, which is not a big difference, but that subtle difference makes a big difference, is, what do I need to do in order to get better? That is the question that we need to ask. Not just simply wanting to feel better, but to get better. How about getting well? Have you ever heard the concept of get well soon? Like you're in a hospital setting and you want to, somebody is sick in the hospital and you send them a card. I don't know if you've ever done this. I've done it before. Or a balloon that says get well soon. Getting well is a wishful thinking concept. It is not based on anything that the person has to do to achieve it. It's just based on you, the wisher, hoping that it will happen to the person. So if you're asking the question, what can I do to get well, or how can I get well, then that also is limited, because getting well is not a destination to arrive at. Wellness is a journey, it's a process, it's an ongoing thing that one ought to do in order to preserve their state in that way. So the wellness understanding is, rather than simply saying, what can I do to get well? How about, what do I need to do in order to stay well? Because staying well requires us to do not the right thing only, but doing the right things over a period of time, over and over again, so that we don't end up breaking down. So it's an ongoing process. It's a journey, not a destination. How about staying alive? There are many persons who measure how well the system is doing by how long people are living. And yes, there is some validity to that, but the reality is that the current healthcare system cannot claim the people living to older age as being a victory that they can put in their hats, because there are other things that are more critical to assure or ensure that people live longer. One of the things is the quality of lives, or the lifestyle that these people live or have. If you think about it, the average person who is 100 years old right now, do they live the way we live? Do they eat the way we eat? Many persons in that generation, it will be hard pressed to find them using microwaves. It will be hard pressed to find them on medication. In fact, most of the persons who are 100 years old now, on average, have less medication that they're on than somebody who is 80 years old right now. The average 100-year-old is on fewer medications than the average 80-year-old. And that's just a 20-year difference. That's just almost one generation ago. So what makes this difference? The difference is because the younger the generation is, the more industrialize our approach to things, and therefore, the more we compromise our own health by choices that we make. So rather than simply saying how long people live, wanting to stay alive as if staying alive is a goal, how about this? What do I need to do in order to feel alive? Because more than staying alive, I think it's more important to feel alive. And so what we find is that persons who don't want or think about the quality of their lives, they don't make certain choices now that can impact it down the road. I hear people saying, boy, my grandmother and my mother lived to be 95, so I'm expecting to live to be 95. Well, if your quality of life is not good, don't expect to live the same lifespan that they would have lived. And this is an important thing to point out. But for me, what's more important than how long we live is how I feel while I'm living. Oh, so by the way, as I go through this, I want to point out there is a subtle change or a subtle difference in the way we live. There's a subtle difference in the way we live and the choices that we make. So if our choices are based on the illness care model, we will have one outcome. If our choices are based on the wellness care model, we will have a different outcome. So watch carefully, please. Feeling better, getting well, and staying alive, they might have value, but their value is limited. What's more of greater value is getting better, staying well, and feeling alive. It's a subtle shift from feel, get, stay to get, stay, feel. Subtle shift. And that's what we are in for. That's what we want. A slight change in how we think to achieve a major difference in our outcomes. So let's continue, shall we? Because the second key is important, which is the truth about pain. And the rest of these will go by a little bit quicker. So, is pain a good thing or a bad thing? How many people will say that pain is a good thing or a bad thing? And if you're the kind of person that I'm gonna ask that you actually make some suggestions, put forward your viewpoints, because I want to hear them, right? And as we participate, we learn more. So let's learn from each other. So put down in the comment section if you think pain is a good thing or pain is a bad thing. Put it in the comment section so we can know. Is pain a good thing or is it a bad thing? I'll give you a little time to just kind of answer that quickly for us, and then we move forward. Is pain a good thing or is pain a bad thing? As the answers come pouring in, let's move forward because, thank you. So let's move forward, right? Because whether pain is good or bad, we have to understand something. Pain has a purpose. It alerts us that something has changed and requires our attention. So whether good or bad, there's a purpose to it. I think we can all agree that pain has a purpose. And this purpose is unfortunately flawed because pain is limited in what it tells us. I don't know if you're aware, but for persons who wait until pain is present before they do anything, they may end up sacrificing a lot before they end up getting any help. For example, you may end up with a situation and you don't have any pain to warn you, but the situation is very serious. And so if that's what you're waiting for, then you may end up making bad choices. You may end up making bad choices. And so when we look at it, um, we cannot simply trust that pain is going to notify us when we need to be notified. And feeling good or having good health and feeling good are not the same thing. Good health is not equivalent to feeling good. So if we want to say we're feeling good, that's just feeling good. If we want to say we're healthy, then you usually feel good if you're healthy, but you don't have to have a problem or to have pain to have a problem. So here we go. Have you ever heard of somebody having something like cancer? And while they had cancer for years, there was nothing to warn them. They didn't have any pain or anything that warned them that the cancer is there. Did you know that that happens? The reality is that that always happens. In fact, there's so many cases where pain fails to alert the person of a problem in their lives. Not every time you have a problem means you're going to have pain with it. You can have psychological issues that don't have pain associated with it. You can have all these things. But the only way to know if you're having good health is if you're checking how your body is working or doing the things that you know are necessary to facilitate good health. Because if we want to have, we can't possibly examine everything. And I mean, even when you do a blood tests are still limited in that they are telling us when something has already gone wrong. Yes, it might be an earlier detection than waiting until the person has a full blown disease, but blood tests for blood tests to be positive, if something has already had to have already gone wrong. So we want to make sure that we are intervening before that. So we have to have a way of checking and regulating how our bodies are working. And good health means having healthy function. And how do we know if our function is healthy? By doing the things that we know are required to maintain the health of our system. So we need to start trusting our function and not our feeling. So when we look at the different systems of the body, there are several systems. Um, and I just go through them quickly. The immune system, digestive, cardiovascular. Integumentary system is a system that involves the coverings, our skin. The organs inside our bodies also have a covering around it. So it's not just a bag of cells. They have connective tissue that connect them together. So there is a covering there. We call it our integumentary system. Respiratory, endocrine, reproductive. The one behind my head. Let me get rid of my head here. Is the excretory system, the musculoskeletal, and the nervous system. These are the systems of the body. Now, if it is that we have a problem in one of these systems, can we claim to have good health? Let us say one of our systems isn't working properly. Let's say our cardiovascular system is not working. Can we say that we're healthy? How about our respiratory system? If it's not working, can we say we're healthy? What about our reproductive system? Can we say we're healthy? What about our musculoskeletal system? Can we say we're healthy? The answer is no. In order for us to be healthy, all of our systems have to be working properly. And thank you, Patricia, for joining us. We see that you're here. Welcome. Now, if we look at the systems of the body, there is one system that is considered to be the master control system of the body. That system governs and regulates the functions of all the other systems. And we call that system the nervous system. It is the master control system of the body because the nerves control the way all our different systems work. So in case you didn't know, I'm going to just try to do a quick zoom in here so you can see. But as you look through, if you look carefully at each of these slide images, what you will see is that for all the organs that you see listed here on the left of the line, there is a nerve connection to it. And this is important. This indeed is very important. And now, if you look carefully, see these yellow bands and these blue bands. So, if you look carefully at them and see these yellow and blue bands, these yellow bands here and these blue ones, they tell us what is going where. For example, every organ that you look at, every single organ has a yellow and a blue that's connected to it. These are nerves. And these nerves, any nerve that connects to an organ, they tell the organ not to start or stop working, but instead they tell the organ how much to work, how much work they need to do. So it will tell the heart whether it should speed up or slow down. It will tell the lungs whether to breathe deeply or more shallow. It will tell our tear glands how much tears to produce, or saliva glands how much saliva to produce. It tells our livers what to do. And so, as we see these things, this is what guides the function of our bodies. This is what guides the functions of our bodies. So, the nervous system is a mass control system. Now, I'm going to try to show you something here that's very, very important, right? Um, when you look at the way the nerves are organized, the nerves have to travel between openings in the spine to go out through the spine to go to the different parts of the body. If you interfere with the passage of the nerves, it will cause dysfunction to occur. If you interfere with the proper transmission of the nerves, then it will cause the nerves to not fire the way it's supposed to fire. And that can be a problem. And so let me show you something here. We call it a vertebral subluxation. This is what a chiropractor means when we talk about a spinal misalignment. That's the technical term for the misalignment, is vertebral subluxation. This is what we know that is. Now, if you have a vertebral subluxation in your spine, and if you look carefully at this, the third bone down from the top, 1, 2, 3, 4, the fifth bone, so the third bone is the middle bone, you'll notice that that bone has been displaced over, right? That bone has been displaced over to the side, so it's no longer lined up. The bones are no longer lined up with each other. One is displaced so that it is off-centered like this, if you will. Instead of lining up, it's off-center. And look carefully at what's happening to the back of the spine. The nerves that are at the back of the spine, have to pass through the openings of the spine. And if the bone is shifted out of place, it closes off the opening where the nerves exit. And if it closes off the opening, then anything that is relying on the information from this nerve is now going to be compromised. So if this nerve controls breathing, breathing will not be normal. If it controls your heart rate will not be normal. It doesn't mean that your heart will stop, but it will mean that the heart rate will not be normal. For example, some persons who have rapid heartbeats. You know, you have your heart racing for no reason at all. Maybe it has happened after you had a fall or after you had a car accident, or a few years later. But that's what we tend to see. Something happens to your spine, and then a function gets changed. Well, this function that changes is dependent on which nerve gets interfered with. And that's how it works. It's as simple as that. Okay, let's move forward again. Lifestyle stress is what causes misalignments to happen in the spine and what causes our bodies to break down. We have physical stress, we have biochemical stress, and we have psychological stress. The physical stress is like car accidents, falls, things like that. Biochemical is like chemistry, things that we put into our bodies. Psychological, things that happen in our minds. These are the things that affect how our bodies work. And so we have to be very mindful of that. Now, the healthier our nervous system is, the better we're able to adapt to our environment. And if we adapt appropriately to our environment, we do not break down and we do not get sick. It is when we fail to adapt that we break down and get sick. And so, since it's our nervous system that helps us to adapt, the healthier the nervous system is the healthier we are able to adapt to our stresses. We call this adaptive potential our general adaptive potential. That is the ability that we have to adapt to our environment. The analogy, the acronym for this is GAP. And I'm going to use a gap analogy to explain this gap, this general adaptive potential. So watch carefully, please, because it's important that we understand. If we're looking at a gap, every gap will have a lower limit and an upper limit, where the space between the two represents the gap. The higher up the upper limit goes is the more you approach vitality. And as the upper limit starts to fall, you are approaching death. So as the upper limit is going up, you're approaching vitality, optimal wellness. If it's coming down, you're approaching death. The space between the two represents the gap. The wider the gap is, the better you can adapt, or the greater our general adaptive potential. Now watch how it works, because it's important. External stresses in our lives will push down on our upper limit. That we call our ES, or external stresses. The only thing that we have to oppose it is our resistance internally. Our internal resistance, or the IR, is what allows us to resist the forces that will cause our limits, upper limits, to fall. If our resistance is good, we don't break down. If our resistance is poor, that's when we break down. That's when we get sick. That's when we get into trouble. So this is important for us. Now, the hope that we have is that all the experiences in our life will exist between the boundaries of our gap. We're hoping that all the experiences in our lives, will be within the boundaries of our gap. If, for example, you see these peaks here, these two ones are the areas where you're most vulnerable. And it can be dependent on your family. For example, some families have a higher predisposition for diabetes, some families have a higher predisposition for cancers, and so on. So whatever your predisposition is, that is where you're most likely to break down. Because if we allow our upper limit to fall because of poor resistance, then we will now find that certain areas will start to exceed our ability to adapt to it. If it is diabetes, then we develop diabetes. If it's cancer, then we'll develop cancer. So whatever it is, that's what we'll develop depending on our susceptibility. So this is what we see. Now, the solution for this is to make sure that our resistance is high so that our upper limit doesn't fall, and that our external stresses are kept in check so that we do not break down. Now, our ability to adapt is determined by the width of our gap. So look at this statement here at the bottom. Our ability to adapt is determined by the width of our gap. The wider the gap is the better we can adapt. The narrower the gap is the worse we adapt. So we want to make sure that our gap remains as wide as is possible. Now, chiropractic, how does chiropractic work? Chiropractic works by improving the way our nervous system works. By realigning the spine, it allows the nerves to carry more appropriate signal from the brain to the body and from the body back to the brain. So therefore, the chiropractic adjustment can improve the communication. You improve the communication, you improve the ability of the body to adapt. If you improve the ability of the body to adapt, we can say loosely that it widens your gap. So chiropractic does widen the gap. However, it is not the only thing that is required to widen your gap. You need to maintain good health in order to widen your gap. And so if your health is not good, you can be in trouble. We have to now in our office we have technology that helps us to identify subluxations or misalignments in the spine wherever and whenever they happen. Now, back in the earlier days, the way this was done was by way of chiropractors just feeling with their hands along the spine to see where things are out of alignment, and we all still do that. We still have to find out where there are problems in the spine. But not for everyone. Not every chiropractor does that. Some chiropractors use other techniques. But what we do all realize is that there is merit to finding out when there is something that has gone wrong and trying to fix it. So we have technology here that we've invested in that helps us to know whenever something is working, something is not working right in the spine. So we measure the temperature of the skin, we measure the muscle tension in the spine. These two devices help to give us some clue as to what's happening with the health of the spine. And this is what we use to tell us when things are working well, when they are not, and how we can go about remedying the situation. Now, there's a very nice study that was done that shows us how chiropractic works. So in this study, this lady was asked to wiggle her left ankle and she was placed under a functional MRI machine to measure the responses of her brain to do the action both before and after a chiropractic adjustment. In the first box here, this is before the adjustment. In the second box, this is after the adjustment. I'm going to try to see if I can zoom in so you can see what is going on here. Now, if you look carefully at this, before the adjustment, you will see that there are areas of light all over the brain. And after the adjustment, fewer areas of light, meaning that after the adjustment, fewer areas of the brain were responsible for the action. If you were to consider them both together and what it means, you'll realize that in the diagram on the left, the more areas of light means that the brain has to work harder to do the same task, which means the brain is less efficient on the left before the adjustment and became more efficient on the right after the adjustment. And that is important, right? So that's what we see. Okay, so let's move forward because there's an important point that I want to bring everyone to, and that is chiropractors are not bone doctors. We are nervous system doctors because the work that we do will impact the nervous system far greater than it will impact the bones. A bone doctor is called an orthopedist. And chiropractors are not orthopedists. Let's continue. I'm a chiropractic neurologist, which means that I have specialized training that helps me to do a little bit more than just what the average chiropractor would do. Not better, just different. So all chiropractors are trained to realign the spine. That's very important. But also of value is that we can use exercises and different therapeutic techniques to retrain the brain in different ways. So as chiropractic neurologists, that's what we are equipped to do, is to retrain the brain using specialized equipment, specialized techniques. These are some of the things that we have actually treated and had a fair amount of success with. So this is what we've seen. Now, at Gardner Chiropractic, our mission is straightforward. We want to identify subluxations wherever and whenever they happen in the spine. That's the misalignments that we need to correct. We need to provide a program of care for persons so that we can improve their overall health. And it's not just a matter of for the short term, but for the long term. And so when we say a program of care, one treatment is not going to fix anyone. So we have to put you on a program, and depending on what's going on, that program will have varying lengths and varying frequencies. What we normally do, however, is before doing an update examination on anyone, we have to do at least 12 sessions. We find that 12 is a good number to know if somebody is improving, yes or no, so that when we do the update examination at the end, we will know whether any improvements we see is a result of just chance or a result of what we have done. And so that is important. We also educate our community by providing information such as what we're giving you here tonight to help persons to understand this healthcare system and to be able to navigate it more effectively. Now, key number 7. Remember, it's the 7 keys to getting and staying well. So this is the punchline. The key to success in getting and staying well is for you to take responsibility for your health and well-being. We have to take responsibility, because if we don't take responsibility for it, then who will? If we don't take responsibility for our own health and well-being, who will? We have to take responsibility. Now, we have testimonials that are available on our website, also on our YouTube page or YouTube channel. So just go to YouTube, type in Gardner Chiropractic, which is the way you would have found our video, more than likely. Or if you found it a different way, just use that method to try to find our channel. Once you find our channel, you will look for our testimonial playlist, and we have many testimonials on there. This is one of my favorite ones, so you can just tune in and listen. All right. Now, for those of you who were able to join us tonight, I asked earlier to please put your names in the chat section. Put your names in the chat section. And I ask this because I want to know who is here so we can make this offer to you. Now, for anyone, and this is the offer, and there is no strings attached because clearly I'm not collecting any money up front. But if it is that you're interested, if you're not yet a patient of ours and you're interested in making an appointment, or you're not going to make the appointment tonight, but you're going to indicate by sending an email your interest. The email you're going to send to appointments@gcnjamaica.com. That's appointments at gcnjamaica.com. If you're not a patient and you're interested in taking advantage of the offer that's going to be made, you have to send an email to appointments at gcnjamaica.com, which is, I've just indicated that in the chat section. And by doing so, just say that you're interested in taking up that special offer, and you will receive a 40% discount off your new patient exam. Not only will you receive a 40% discount off your new patient exam, you don't necessarily become a patient immediately, because I have to make sure that what's going on with you is something that we can actually help with. If we can help with it, then we'll go ahead and tell you what you need to do. We'll make the appointment for you. We'll bring you in, go over with you what we have, what's going on with you, and then we will plan what goes on next, right? So you'll get a 40% discount off the cost of the new patient exam. Now, if you are an existing patient, meaning that you've already gotten an examination and we did your report of findings and invited you to listen, well, you will get a discount off your update exam, which is almost the same cost of the new patient examination. So you get a 20% discount off the update exam. Not only will you get a 20% discount off the update exam, but you will also get a 20% discount off one treatment for every one person that you refer. So if you refer someone to the office, you'll get a discount of 20% off one treatment. If you refer 5 people, you get 20% discount off 5 treatments, or you can even get the 20% discounts off one treatment. That will give you a free treatment if you choose to do it that way. But this is of great value, right? And the last thing is your phase discount. At the end of a phase, when we do a series of care, we put people on a plan. At the end of the 12 treatment plan, we re-examine you. That's where we do the update exam, for which you get that 20% discount. But should further treatments be required or recommended or suggested, then you will get another 10% discount off those treatments. And that is important. So you stand to gain a lot more than the person who is not currently a patient. And I don't mind that, because I believe we should treat our existing clients better than people who have never proven themselves even faithful to us in the first place. After my new patients or my new clients have decided to support the practice in whatever way, or we're getting help from the practice, then we can start to take care of each other even better. But I love my people who love me, and so we take care of you very well. But this is a special offer, 40% discount, and all you have to do to get that discount is just to submit an email to appointments at gcnjamaica.com. And if you don't want to, if you're already a patient and you do not qualify for that 40% discount, then you will qualify for the existing patient discount, which is 20% discount off the update exam, 20% discount off any treatment that you refer someone to the office, and a 10% discount off the next phase of care. So that's what we see. I hope that this is helpful and that you would have learned something tonight. Please find us on our different social media platforms. If you go to our website, it's located at gcnjamaica.com, or you can visit us on Facebook at gcnjamaica, or if you want to follow us on YouTube, it's Gardner Chiropractic. But also, I don't know if you are already aware, but if you're not already aware, we have a special radio program that we have in Jamaica that's live on air on RGR 94 FM on a Tuesday night at 7 p.m. Sorry, at 8 p.m. Between 8 and 9 on a Tuesday night is when we have this show. It's called Back to Health Talk Show. and we also stream it live on Facebook. So if you want to participate in the show or just watch the show, go to Back to Health Talk Show now, subscribe or like, not subscribe, but like the page, and you can look through. We have videos on many topics that we have discussed, and we discuss various health topics. And I think some of them are very interesting, and you will be able to participate, watch it, and enjoy them at your leisure. So that's what we will do. So, ladies and gentlemen, the 7 keys to getting and staying well. We need to make the most out of these options that we have available to us, because sometimes people make bad choices, but the bad choices that we make is not necessarily because we don't want to make better choices. And it's not just because the good choices are more expensive, although sometimes that's the case, but because we just don't know better. And so we want to make sure that we know more so we can make wiser choices as we're going along. So those are my 2 cents. I thank you for playing along. I thank you for participating. I'm going to leave this up. The video, I'm going to leave it up so that you can access it and, enjoy it. I might leave it up permanently. I might just leave it up for tonight for those who were not able to join us directly themselves but will join us later on. I'll try to leave it up for them. So, thank you so much for participating. I hope you appreciate the information that I was able to share with you. I hope you have learned a thing or two. And I look forward to seeing you again very soon. And just be blessed. Remember that there are lots of things going on in our world. There are people who do not wish to have us make wise choices. If we do not understand our healthcare system or do not understand our bodies or how our bodies work, we will constantly be taken advantage of. So it is my hope that you seek to educate yourselves, to inform yourselves, so you make a better, wiser choice. Thank you so much, and do have a wonderful, blessed night. And I will see you very soon. Take care now, and may God bless.